Beverley Allitt was born on October 4, 1968. She grew up in the village of Corby Glen near the town of Grantham. She had 2 sisters and a brother. Her father Richard worked in an off-license, and her mother worked as a school cleaner. Beverley attended Charles Reed Secondary Modern School, having failed the test to enter Kesteven and Grantham Girls' School. She would often volunteer for babysitting jobs and left school at the age of 16, taking a course in nursing at Grantham College. As a child, Beverley would use factitious injuries in order to gain attention. She took to wearing bandages and casts over wounds but would not allow them to be examined. She became increasingly attention-seeking, often showing aggression toward others. As a teenager and overweight, Beverley began spending an excessive amount of time in hospitals with numerous physical complaints. At one point she convinced a surgeon to remove a perfectly healthy appendix. When they realized what she was doing, she would doctor shop, moving on from one physician to the next. Medical practitioners became familiar with her attention-seeking behavior. Beverley Allitt's behavior in adolescence appeared to be typical of Munchausen syndrome, and when this behavior failed to elicit the desired reactions in others, she began to harm others in order to satisfy her desire to be noticed. She went on to train as a nurse and was suspected of odd behavior, such as smearing feces on walls in a nursing home where she trained. Her attendance during her training was poor due to her many illnesses, and as a result she failed her nursing examinations. Her boyfriend at that time said she was aggressive, manipulative, and deceptive, claiming false pregnancy, as well as rape, before the end of the relationship. Despite her history of poor attendance and successive failure of her nursing examinations, she was taken on a temporary 6-month contract at the chronically understaffed Grantham and Kesteven Hospital in Lincolnshire in 1991, where she began work in the Children's Ward No. 4. There were only 2 trained nurses on the day shift and 1 for nights when she started, which might explain how her violent, attention-seeking behavior went undetected for as long as it did. She was later known as the Angel of Death. She is one of Britain's most notorious female serial killers. Her murderous spree was all the more shocking because she would befriend the parents of her victims who entrusted their children into her care. On February 21, 1991, 7-week-old Liam Taylor was admitted to the ward for possible pneumonia. After Beverley had reassured his parents that he was in capable hands and would be well cared for, they went home for the night. When they returned the next morning, they were informed that he had suffered respiratory problems during the night but that he had recovered and appeared to be doing well. The next night Beverley volunteered for extra night duty. At one point during the night she was left alone with little Liam, and moments later she summoned the code team. He had stopped breathing. Despite the efforts of the team, Liam had suffered severe brain damage and was being maintained on life support. Knowing that he would never recover, his parents made the heart-rending choice to remove him from life support. His death was listed as heart failure. Even though her fellow nurses were confused about the failure of the apnea monitors to alarm when Liam stopped breathing, Beverley was never questioned. 2 weeks later, 11-year-old Timothy Hardwick, who suffered from cerebral palsy, was admitted after suffering an epileptic seizure. Beverley volunteered to care for him. Within a few moments of being left alone in her care, his heart stopped. And again, despite the efforts of the code team, they were unable to revive him. His death was attributed to his epilepsy even though no obvious cause of death was found. Beverley Allitt's third victim was 1-year-old Kayleigh Desmond. He was admitted to Ward 4 on March 3, 1991 with a chest infection, from which she seemed to be recovering well. 5 days later, with Beverley in attendance, baby Kayleigh went into cardiac arrest in the same bed where Liam Taylor had died a fortnight before. The resuscitation team were able to revive her and she was transferred to another hospital in Nottingham. Attending physicians discovered, during a thorough examination, an odd puncture hole under her armpit. They also discovered an air bubble near the puncture mark, which they attributed to an accidental injection, but no investigation was initiated. On March 20, 1991, 5-month-old Paul Crampton was admitted for bronchitis. Shortly before he was to be discharged, he was taken care of by Beverley. He was nearly comatose, and when his blood was checked he was found to have a high level of insulin. He would suffer from the same symptoms 3 more times before he was transferred to another hospital in Nottingham. When he arrived at the hospital, his blood was checked and he was again found to have a high level of insulin. The nurse that was sent with him in the ambulance was none other than Beverley Allitt. Miraculously he survived. The next day, 5-year-old Bradley Gibson, a pneumonia sufferer, went into unexpected cardiac arrest but was saved by the resuscitation team. Subsequent blood tests showed that his insulin was high, which made no sense to the attending physicians. A visit from Beverley later that night resulted in another heart attack and Bradley was transported to Nottingham, where he recovered. Despite this alarming increase in the incidence of unexplained health events, all in the presence of Beverley, no suspicions were aroused at this time and she continued unchecked in her spree of violence on poor defenseless babies. On March 21, 1991, 2-year-old Yik Hung Chan was admitted to Ward 4 after falling from a window and suffering a skull fracture. While he was being cared for by Beverley, his oxygen levels dropped dangerously low twice. He was transferred to a larger hospital in Nottingham. His symptoms were attributed to his head injury. On April 1, 1991, 2-month-old Becky Phillips was admitted for a stomach virus. While being cared for by Beverley, she began exhibiting symptoms of hypoglycemia. She was examined and finding nothing wrong, Becky was sent home with her mother. During the night she went into convulsions, and when her parents contacted a physician they were told that she probably had colic. She died later that night. As a precaution, her twin sister, Katie Phillips, was admitted to Ward 4. Not long after being cared for by Beverley, she stopped breathing and had to be resuscitated. 2 days later she stopped breathing again, but this time she suffered permanent brain damage due to prolonged lack of oxygen. When she was transferred to another hospital, it was later found that her apneic spells had been the result of her receiving large doses of insulin and potassium. Katie's mother, Sue Phillips, was so grateful to Beverley for saving her baby's life that she asked Beverley to be her child's godmother. Beverley Allitt graciously accepted. 4 more victims followed, but the high incidence of unexplained attacks in otherwise healthy patients, along with Beverley's attendance during these attacks, finally caused suspicions to be raised at the hospital. On April 22, 1991, Beverley's violent spree was brought to an end with the death of 15-month-old Claire Peck, an asthmatic who required a breathing tube. Whilst in Beverley's care for only a few minutes, the infant suffered a heart attack, but the resuscitation team revived her successfully. Once more alone in Beverley's presence, baby Claire suffered a second attack from which she could not be revived. Although an autopsy indicated that Claire had died from natural causes, Dr. Nelson Porter, a consultant at the hospital, initiated an inquiry. The high number of cardiac arrests over the previous 2 months on Ward 4 alarmed him. An airborne virus was initially suspected, but nothing was found. A test that revealed a high level of potassium in baby Claire's blood resulted in the police being summoned 18 days later. Her exhumation resulted in the discovery of traces of lignocaine in her system, a drug used during cardiac arrest but never given to a baby. When the police were finally notified, they examined the records of 25 suspicious cases. In most instances, the victims, 4 of whom were dead, either had high levels of insulin or potassium or both in their systems. The only common factor linking all the cases together was Beverley Allitt. By July 26, 1991, police felt that they had sufficient evidence to charge Beverley Allitt with murder, but it wasn't until November 1991 that she was formally charged. Beverley Allitt showed calm and restraint under interrogation, denying any part in the attacks, insisting she had merely been caring for the victims. A search of her home revealed parts of the missing nursing log. Further extensive background checks by the police indicated a pattern of behavior that pointed to a very serious personality disorder. She exhibited symptoms of both Munchausen syndrome, and Munchausen syndrome by proxy, which are characterized by gaining attention through illness. With Munchausen syndrome, physical or psychological symptoms are either self-induced or feigned in oneself to gain attention. Munchausen's by proxy involves inflicting injury on others to gain attention for oneself. It is fairly unusual for an individual to present with both conditions. When this behavior failed to elicit the desired reactions in others, she began to harm her young patients in order to satisfy her desire to be noticed. Despite visits and assessments by a number of healthcare professionals whilst in prison, she refused to confess what she had done. After a series of hearings, she was charged with 4 counts of murder, 11 counts of attempted murder, and 11 counts of causing grievous bodily harm. As she awaited her trial, she rapidly lost weight and developed anorexia nervosa, a further indication of her psychological problems. It was the harshest sentence ever delivered to a female, but it was commensurate with the horrific suffering of the victims, their families, and the ignominy she had brought upon nursing as a profession. Indeed, the impact on the Grantham and Kesteven Hospital was so severe that the maternity unit was closed down altogether. Rather than going to prison, she was incarcerated at Rampton Secure Hospital in Nottingham, a high-security facility mainly housing individuals detained under the Mental Health Act. As an inmate at Rampton, she began her attention-seeking behavior again, ingesting ground glass and pouring boiling water on her hand. Beverley Allitt subsequently admitted to 3 of the murders for which she was charged, as well as 6 of the assaults. The appalling nature of her crimes placed her on the Home Office list of criminals who will never be eligible for parole.